and I'm up your nurse today. Hi. How are you doing today?
Good.
Get some hand hygiene, my gloves on. Okay, first thing I need to do is check your identity. And borrow your wristband, and can you tell me your name and date of birth, please?
Winfred, April 23rd.
Okay. Boop. All right, so Winfred, what's going on today is we are doing a head-to-toe assessment. Head-to-toe assessment is just that, it's an assessment from the head to the toe. We're going over all your body systems, just checking for abnormalities as I go. Going to be having you perform some exercises here and there, and mostly though just inspecting and touching and listening with that stethoscope. Do you have any questions before we begin?
No.
Okay. And if you should have any questions along the way, just let me know. And is it okay if we get started?
Yeah.
All right. First thing I'm going to do is just close the door here for your privacy. Okay, just checking your computer information here. So this tells me you're a 36-year-old male. You are 5'9", you weigh 160 pounds. We did a smell and eye chart assessment earlier on you, and you got 20/20 in both eyes, 20/20 in your right, and 20/20 in your left eye. You don't wear any glasses or hearing aids or other assistive devices like that?
No.
Okay. And do you ambulate with a walker or a wheelchair or use a cane?
Mm-mm.
Alrighty, so your mobility is free and clear, you're able to self-ambulate?
Yes.
Alright. Well, I've already asked you your name, I've got a few more questions for you. So can you tell me where you are?
Hospital.
Okay, and do you know why you're here?
Head to toe.
That's right. And can you tell me the date today?
November 30th.
Okay, that's correct.
Oh.
Alright, patient is A&O times 4. Alright, so I'm going to ask you about your pain now. So on a scale from 0 to 10, 0 being no pain, 10 being the worst pain you've ever felt, what would you say is your numeric pain rating right now?
0.
Okay, patient reports a 0 out of 10 on the numeric pain scale. Alright, so from all that I can glean a few things. So it seems like you can understand me well. There's any signs of hearing loss or hearing damage. You're making appropriate eye contact as we're talking. Your skin is appropriate color for your ethnicity. Your facial expression is relaxed for the situation. Your posture is upright and erect, and your build is normal for your age. Seeing that you are well nourished, well groomed, your mood is congruent with your affect. Your speech pattern has the right rate, rhythm, and tone. And just upon initial inspection, everything seems symmetrical with your body. I'm not seeing any musculoskeletal irregularities or any apparent lesions, excessive or unusual nevi, or unusual hair pattern growth either. Okay, I'm going to go ahead and get started now on just an inspection and a palpation of your scalp. So, first thing I want you to let me know if anything is tender when I do this. Any tenderness through these areas?
No.
How about back here?
No.
Okay, hair is soft and full. I'm going to check now. No signs of infestation, no signs of lesions. Again, no excessive or unusual nevi. Okay, and no signs of alopecia or excessive dryness. Alright, moving to the face. Oh, and I didn't feel any depressions or protrusions in the skull either. Okay, moving to the face. So just checking for symmetry along all sides. So the nose is along the midline, both eyes are symmetrical, both ears are symmetrical, or in the place that they need to be. Eyebrows are symmetrical. There's no signs of drooping in the eyes, the eyelids, the eyebrows, or the mouth. Not showing any signs of cyanosis or any lesions on the front of the face. And nose is not showing any nodules or any drainage or anything like that. Okay, just going to do some light touch. Let me know if anything's tender in your frontal and maxillary sinuses. Any tenderness through these areas?
No.
Okay. Skin is warm and dry. Tenderness down here through any of your facial bones?
No.
Okay. Up through here, the tenderness?
No.
Okay. It's going to have you open and close your jaw a couple times. Perfect. There's no clicking or popping noted on the temporal mandibular joint. Alright, so first thing we're going to do is I'm going to go through some just some exercises to check your muscles in your face. So could you smile for me? Okay, and with teeth. Alright, can you stick out your tongue? Perfect. And can you puff up your cheeks with air? Okay, patient can perform all exercises, cranial nerve setting is intact. Okay, next is going to be a sensory check of your face. So I got a tissue in the room. Right here. Just going to be moving this tissue on your face, so I want you to stay there when you can feel it. Go ahead and close your eyes.
There. There. There.
Okay, patient is sensitive to light touch. Next, I have a tool here that I made out of a tongue depressor. It has a sharp and a dull side. I'm just gonna have you close your eyes and let me know whether you feel a sharp or a dull sensation.
Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull.
Okay, patient can distinguish between dull and sharp sensations, so they are aware and can sense pain in the face. Their cranial nerve 5 is intact. Okay, I'm going to be moving now into the eye assessment. So first thing, just checking for the eyelids. No signs of drooping. I'm not seeing any nodules or lesions on the eyelids. Eyebrows are groomed well. I'm not seeing any signs of lesions there either, or signs of infection or infestation anywhere. Okay, can you take your eyelids and pull them down and look up for me? Okay, sclera is white and conjunctiva is clear and pink. The lacrimal ducts are free of unusual discharge. Okay, and patient, do you have any eyes? Or, I'm sorry, do you have any eyes? No. Do you have any pain in either of your eyes? No. Signs of swelling or anything? Okay, no, that's like glaucoma or something like that either. Okay, first thing I'm going to have you do with the eyes is I'm going to have you focus on my pen light here. I'm going to move this around and we're going to be testing your cranial nerves 3, 4, and 6 with this exercise. Just stay focused on this as I move it around. Do not move your head. Okay, eye movements are steady and free of fasciculations. No signs of that. Okay, so those cranial nerves are intact. Okay, next I'm going to assess your peripheral vision. I'm just going to have you cover up one eye. I'm going to bring this pen light into your peripheral vision. Just let me know when you can see it by saying there.
There. There. There.
Okay, next side.
There. There. There.
Okay, patient's peripheral vision is intact, so that gives us clue that optic nerve 2 is functioning well. Okay, I've done the periphery, we've done the eye movement test. Next is going to be a pupillary light response, corneal light reflex, and accommodation. So I'm going to dim the lights in the room. Sorry, Jeff. Okay, I'm going to shine a light right into your eyes, just temporarily. Just want you to look right here at my hand as I do so. Okay, pupils constrict in the presence of light consensually. Next, I'm just going to shine a light directly at your eyes. Just want you to look right here with that light. Okay, corneal light reflex is intact. Sorry about the headlights I just gave you. Reflection is straight back at me without signs of deviation either way. Okay, next I'm just going to be focusing on my pen here as I bring it close and far away. Okay, patient's pupils dilate when the object is far away and constrict when the object is near, showing that they have intact accommodation. At this point, we can say the pupils are equal, round, reactive to light and accommodation. Okay, now we've done an inspection, we've done the peripheral eye test, we've gone through all cranial nerves and the eye, so 2 and 3 are intact. Okay, I feel good about moving on to the ears now. So I'm just going to take an inspection and a feel of each ear. Upon initial inspection, cerumen and hair quantity is normal and expected for sex and age. I am not seeing any drainage or blood, some material drainage, and signs of infestation or infection. No nodules present on the outside edges of the ear auricles. I'm going to go ahead and touch your ears. Let me know if any of this is tender on auricles and the pinna. No tenderness there? Okay, perfect. So we're going to do something called a whisper test. I'm going to whisper something in one ear. I'm going to have you plug up the other ear with your finger and kind of move it around a little bit. Just repeat back to me what you hear.
A, B, C.
Okay, the other ear.
1, 2, 3.
Okay, so cranial nerve 8 is intact, so the positive testimony for passing of the whisper test. Okay, moving on to your nose now. I'm just going to have you kind of look up a little bit and just pull your nostrils open for me. Good, that's perfect. Okay, turbinates are free and clear of inflammation. Septum is along the midline and not deviated. Not seeing any holes in the septum. The hair and mucus is normal quantity, and mucus is clear. And there's no signs of nodules or lesions. Is any of this tender at all? No? Okay. I'm just going to have you plug up one nostril with a finger and take a breath in and out through the other nose. Okay, and the other side. Alright, both nostrils are pat. Alright, moving on to the mouth. So, first thing, just an inspection of the mouth. Again, no cyanosis. It is centered along the midline. Not showing any signs of excessive dryness or any lesions on there as well. Go ahead and open your mouth for me. Okay, checking the oropharynx and the submucosa, and not seeing any lesions. And you stick out your tongue and say "ah" for about 5 seconds. Okay, that's good. The uvula is along the midline, does not deviate during the ah test. The soft palate also elevates appropriately without deviation. Tongue is free of tremors. Not seeing any dental caries. The gums are pink and moist without lesions. Appropriate amount of moisture in the mouth as well. Okay, just gonna have you stick out your tongue, move it to the left. Sorry, I don't know, yawn there. Move it to the right, move it down, and move it up, and hold it there. All right, seeing 2 veins underneath the tongue, and again, the submucosal is free of any lesions and things of irregularness, any thrush or whatever. Okay, from that we can also distinguish that you, from the ah test, sticking out your tongue and speaking to me, that cranial nerves 9, 10, and 12 are intact as well. Okay. And I feel pretty confident moving on to the neck now. We've gone to the ears, eyes, nose, mouth, and face, and hair. So the first thing I'm going to do on the neck is just topic the lymph nodes. So just let me know if you feel any tenderness in any of these regions. Pre-auricular, post-auricular, superficial cervical, posterior cervical, deep cervical, tonsillar, submaxillary, submental, and supraclavicular. No tenderness through those areas at all? Okay, lymph nodes generally speaking not palpable, so didn't feel any lumps and no signs of immobility or inflammation. And skin is warm and appropriate temperature as well. Okay. I'm just going to have you look up for me. I'm just going to inspect the trachea, thyroid region. All right, that's along the midline. Not again seeing any bumps or things that would indicate a problem there. Not seeing any deviation. Can you just do a swallow for me? Okay, and deep breath in and out. Perfect. I'm just going to check your thyroid gland here, see if I can feel it. Okay. Any tenderness through these regions? Okay, the thyroid is not enlarged. Okay, no signs of tracheal tugging either, and the swallowing motions made are appropriate movements throughout. Okay, just going to have you shrug your shoulders up for me. Check cranial nerve alignment real quick. Yeah, that's perfect. Okay, going to do some passive or just some range of motion with your neck. Going to have you touch each ear to your shoulder one at a time. Towards your shoulder. Okay, go ahead and turn your head left and right. Okay, going to look all the way down to the ground and look all the way up to the sky. Okay, perfect. And chin to shoulder one at a time there.
Chin to shoulder?
Yeah, just kind of down your shoulder. Okay, perfect. I'm going to do all that now with some resistance, so I just want you to push your head against my hand there. Okay, and this side, perfect. Now turn your head, okay, and turn your head, and move forward, and back. Alright, that's great. So full range of motion in the neck with a 5+ strength score. Okay, and next I have, I'm just going to feel you for your carotid arteries. I'll think this. Okay. Okay, it's a 2+ pulse. And that's bilaterally. Not seeing any signs of jugular venous distension. Okay, just going to take a listen now to those. Checking for bruise with my bell. Alright, no signs of bruise in the neck. Okay, and just real quick, I want to make sure I'm going through everything. So I got the whole face, eyes, nose, mouth, ears, and the scalp. Talked about the neck. We did your lymph nodes this time. We got your thyroid and we checked your trachea. Okay, I feel comfortable, go ahead and moving on now to the upper extremities. So just checking your arms real quick here. Okay, is there any way you can take the shirt off for me actually? Thanks, sir. Alright, musculoskeletal build looks normal. Not seeing any signs of hyper or hypotrophy. Skin is warm and dry. Not feeling any signs of not seeing any signs of cyanosis, no cold, unusual cold temperature in the extremity. Each nail looks well groomed for the capillary refill, less than 3 seconds. And bilaterally. Okay, skin is free of lesions, and there's no unusual nevi, excessive nevi, or unusual hair growth as well. Okay, going to be checking your pulses real quick. So going through first with your radial pulses. All right, it's a 2+ bilateral and symmetrical pulse there. Brachial pulses is a 2+ bilateral and symmetrical pulse as well. Okay, in that position there, just go ahead and do a bicep curl and come on back. I'm going to have to scoot your chair maybe a little bit and take your shoulders upward. Okay, and back down. Then come out and rotate your hands up and down. Okay, move your wrists down and up. And then fingers spread and back again, and then they rest. Okay, I'm doing all that now with some resistance. So back to the bicep curls, go ahead and push up. Okay, push back. Shoulders are going to come up. Okay, and down. Okay, hands out. We're going to do wrists down and wrists up. Okay, I'm just going to give you a squeeze there. Perfect. Okay, full range of motion in all the upper extremity joints with a 5+ strength score in each. Okay. All right, moving on now to the back. Just going to have you rotate the chair maybe so you're facing this direction. That'd be great. Thank you. All right, just doing an inspection of the back. I'm not seeing any signs of nevi, unusual nevi, excessive nevi. There's symmetry between the scapula. The shoulders are also showing good symmetry with no signs of muscular atrophy or incongruity. The spine is centered along the midline. Not seeing any evidence of lordosis, kyphosis, or scoliosis. The anterior posterior side shows no signs of evidence of barrel chesting. Okay, just going to pop it here. We know if any of this is tender. Tenderness in either scapula. Tenderness up here. Tenderness along the spine. Okay. All right. Just going to do a quick inspection of just your breathing pattern for a second. So thoracic region seems to expand normally with no signs of heavy heaving or exasperated breaths. Okay, locating 10th rib. Go ahead and do a breath in and out. Okay. Thoracic expansion appropriately within 3 to 5 centimeters. All right, I'm going to take a listen now through your back, checking for your lung sounds. When you hear or feel the stethoscope, just take a breath in and out. Okay, I heard no signs of adventitious breath sounds or vesicular sounds throughout all lung lobes. Okay. All right, I'm going to have you move up here to the table. Let me get a pillow for you. Just going to lay on your back. Okay, initial inspection. Not seeing any signs of lumps or musculoskeletal deformities again. Skin is free of lesions, excessive or unusual nevi. Hair pattern is normal for the sex. Just going to palpate. Is any of this tender through your chest? This. Going to be listening now to your lungs again on this side. Same thing. Just take a breath in and out. Okay, no signs of adventitious breath sounds again, no signs of wheezing, crackles, or friction, pearl friction rough. All right, I think the lung assessment is good. I'm going to move on now to your heart. Just checking for the precordium here. Okay. Okay, the point of maximum impulse on the left side, mid-clavicular line, fifth intercostal space. Pulse feels like a 2+ with no signs of lifts, thrills, or heaves. Okay, gonna take a listen now. First, the aortic, pulmonic, secondary pulmonic, or tricuspid, and then mitral. Okay, gonna go back through my bell, with my bell, and then mitral, and then tricuspid, secondary pulmonic, pulmonic, and aortic. Okay, I'm going to have you lean down to your left side if comfortable a little bit, just taking a listen to that PMI with my bell. Okay, thanks, you can come back and relax a little bit. So I hear clear S1 and S2 sounds, no sign of S3 or S4, no murmurs, gouts, or a pericardial friction rub. You can hear any signs of bruise in and around the chest and around the PMI here. Okay, moving on now to your abdomen. So I'm just going to be checking first for any signs of peristalsis, a blockage. The skin looks free of lesions and has normal hair pattern. Okay, just going to be doing the listen now. Let me know if you're feeling discomfort. Okay, your bell sounds in all 4 quadrants. Let me know if any of this is tender, so some touch. Okay, a little bit deeper. No tenderness so far. Okay, not feeling any lumps. Again, no signs of peristalsis in there. Okay, everything seems to be functioning with the abdominal system. All right, moving now to the lower extremities. First thing is checking for symmetry. I'm seeing both legs are symmetrical. No signs of one leg being a little bigger than the other, which would indicate a DVT, unilateral swelling. I'm seeing normal hair growth. Seems to be no lesions or excessive or unusual nevi, and no signs of hyper or hypotrophy. On palpation, skin is warm and dry on the feet and the legs. Okay, no signs of pitting or edema. Checking capillary refill on 10 toes. Okay, capillary refill is less than 3 seconds. No signs of infestation or infection. Nail beds, they're well groomed as well. Checking pulses. First, the dorsalis pedis pulse. 2+ bilateral and symmetrical. Posterior tibial. 2+ bilateral and symmetrical. Popliteal. 2+ bilateral and symmetrical for popliteal. Okay, going to be going through some range of motion now for the lower extremities. I'm just going to have you bring this knee up to your chest. Okay, and extend your leg upward. Bring your leg back down to a bent position. Hip out to knee. Hip back towards this way. Okay, then back to laying down. Going to do that one more time on this side with some resistance this time. So just go ahead and bring your leg up. Okay, back down. Okay, and leg up. Okay, and down. Hip out to knee. And hip inward. Okay, you can relax that leg. And do the same thing over here. Just go ahead and bring your knee up to your chest. Extend your leg upward. Bring your leg back down. Hip out to knee. Hip inward. And back down again. Okay, and one more time now with resistance. Back to me. Good. That's good. Yeah, thank you. Go ahead and come up. Then hip outward and hip inward. Okay, relax now. So, full range of motion with 5+ strength score in the hips and knees, as evidenced through their flexion and extension, abduction and adduction. Going to the ankles now. I just want you to pull your feet towards you, and now gas pedal toward me. Okay, so you'll wiggle all your toes, and then clench your toes. Okay, it's going to pull your feet towards you again. Okay, and push down toward me. Perfect. All right, so that's full range of motion and a 5+ strength score for the ankle joints through flexion and extension, as well as the toes through flexion and extension. Okay, that concludes the lower extremities. I'm going to go through and do a neurological assessment generally now on all of your extremities, starting off with that tissue again we did earlier. Just want you to stay there if you can feel it. So close your eyes.
There, 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 there.
Okay, and same thing with the tool now, sharp end dull. Go ahead, close your eyes.
Dull. Ah, sharp. Sharp.
Sorry.
Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay, they can distinguish between dull and sharp sensations throughout their whole neurologic system. So their neurosensory system is intact. Okay, I'm going to have you now move to a seating position right here on the side of the table. Nice. Well done. Okay, patient moves smoothly through their movements, not seeing any signs of shakiness. They exercise good body mechanics and all of their muscle movements work well coordinated as well. Okay, first I'm going to do your patellar tendon reflex here. So just go ahead and relax. Alright. Okay, that's a 2+ reflex score for each patellar tendon reflex. Alright, now sitting here, I'm just going to have you put your hands flat on your lap. We're going to do some gross motor movement checks. So I'm just going to have you rotate between moving your hands up and down on your lap here. And go ahead and speed up as you can. That's perfect. Okay, gross motor function is intact, bilaterally and coordinated as well. Okay, next do a fine motor test. Now you bring both your hands up. You're going to touch your thumb to each finger systematically, backwards and forwards. Go ahead and do that. Okay, and a little faster if you can. All right, that looks great. So fine motor skills are intact, bilateral, and coordinated. All right. Next is going to be a proprioception test. So I'm going to have you put both hands outward with your fingers up, and have you close your eyes and one at a time bring a finger to your nose, alternating back and forth. Okay, see if you can speed up while doing that. That's perfect. Okay, patient sense of proprioception is intact, with movements that are coordinated bilaterally, smooth movements as well throughout. Okay, next is going to be a stereognosis test. So I'm just going to have you close your eyes. I'm going to put something in your hand. I want you to tell me what it is.
It's a pan.
That's correct, a pen. Okay, stereognosis is intact. Okay, I'm going to have you just come to a standing position here in front of the table now. Yeah, that's perfect. You feel any shakiness or dizziness? Okay. So, first thing we're going to do here is some range of motion with your spine. So I'm going to have you just bend forward and touch your toes and hold it there for a sec. Then checking the thoracic region of the spine, no evidence of scoliosis, kyphosis, or lordosis. Okay, you can bring that back up. I'm going to go into a hyperextension now all the way back. Okay, that's good. And you're going to bring one arm up and over each shoulder, one at a time. Okay, and just going to do a careful twist back and forth as well. Okay, full range of motion in the back. Movements are free of any. Did you feel any pain through that? Free of any pain and no signs of unsteadiness or shakiness either. Okay, next we're going to do a Romberg test. So I'm going to have you just look forward normally and go ahead and put your feet together. Okay, no signs of shakiness or unsteadiness so far. Go ahead and close your eyes. Okay, you can open your eyes now. So that would be a negative for the Romberg test. Your cerebellum is functioning well and your sense of balance is maintained and proprioception is intact. Okay, now we're just going to move now to some gait assessment. So I'm just going to have you kind of stand over here and take about 6 steps forward. Okay, go ahead and turn around and head back. Okay, gait is normal, steady with the right rate and rhythm, not showing any signs of shakiness or unsteadiness either. Now I'm going to have you do a heel to toe towards me as well, when not impeded by a dog. Okay, just going to go backward now through that same motion. Okay, patient can complete the heel to toe effortlessly. They are zen and in a good state of balance and coordination since proprioception is intact. And with that, I have one more test actually. So I'm just going to have you put your fingers together in this shape, checking for Okay, thanks. Not seeing any signs of nail clubbing, and again, no signs of spooning nails either. That would indicate a lung or iron problem. All right, and with that, we are concluding the head-to-toe assessment. Do you have any questions for me before we start? All right, and thank you very much for your time.
Thank you.